The Harbor Health Organization held a back-to-school health fair, which will help prepare the kids for the new school year. Everyone that came by was able to get tested and screened in order to make sure they were in good health. PCN stopped in to learn more.
Harbor Health is a community organization, a community-based organization. We own and operate community health centers from Boston, Plymouth to down the Cape. And we work with everybody in the communities that we serve. Our staff, our primary care staff as well as dental staff, approached the marketing department about 6 months ago and said, we had a couple of instances where people came in and they did not know that they needed actually to take a battery of tests. As you know, basically they progress and they become 40, 45, 50, etc. It seems that they're not aware that they should be getting through screenings, specific screenings based on their age. But also they're not aware that there are certain things that they need to do at milestones throughout the year, whether it's the beginning of the school year or it's something else. And we said, oh, so what would you like to do? And they said, we would like to put a health fair together. We were pleasantly surprised, and we said, absolutely. So what we've decided to do is put together a back-to-school event, and we wanted to coincide with National Health Center Week. And it does. Actually, we're celebrating National Community Health Center Week this week. And we wanted also to let parents know about immunizations, what they need to do in order to prepare their kids for the new school year, the new calendar school year. We wanted basically to have the parents come in with their kids and not only get the screenings for their kids, but also for themselves. So especially today, we're offering a number of screenings that they're all free of charge. And include from mammography tests to basically getting their teeth checked, to getting information from our pharmacy team about medication and over-the-counter medication and what should be taken and what should not be taken. Also, anything that has to do with behavioral health and how to prepare the kids for the pressures of the new school year. We have blood pressure screenings, we have cholesterol screenings, we have diabetes screenings. We're not going to stop there. Everybody who stops by and basically gets that information or gets screened, if we see that their numbers are somewhat alarming, but they're not indicative for them to go to their emergency room, we are going to give them basically information to go back to their primary care and follow up right away.
Today we're having a health fair to try and encourage people to come in and get preventative screenings, to hopefully encourage them to catch something early rather than when it's too late and they maybe can't do something about it.
One of the reasons that we decided to have it is I actually have a personal story about a patient of mine who'd come in as a new patient, got her set up for primary care, and on the next visit she mentioned something to me on her about something on her breast, and it actually turned out to be cancer. It was really an emotional and poignant moment for me, because I felt like we really did a great thing for her, and for her to come and be brave enough to mention it to us, that she was able to get the health care she needed, and she's now in treatment. And so I'm hoping that other people can see that screening exams can really save their lives.
Hopefully next year will be bigger and better, and we'll welcome everybody to come down next year and join us.